I think the plenary session is very, very important, not for the discussion, but for the overview. And the good thing is that it provides a large picture of how the different projects go together, how do they hang together, and also of the advances that the full team is doing. I see it evolving, and also in the plenary there, you can see how it has been evolving. Well, very much from being a group of scientists dreaming to make an operational system to realists coming in and seeing the results and the growth of that system. And it's very nice to see that the dream we had 15 years ago is coming to place.
Well, apparently the numbers of participants are growing, so it's good. It's good to see the sessions being filled up, and people are quite interactive. There are good discussions both in the room and in the coffee breaks.
Yeah, for us it's been really important to put faces and also to get more about other contractors and know what are they working on. Now we saw their faces, we could communicate with them, and we know a bit more on their contribution to CAMS as well. So we can, in this way, collaborate and give them better assistance on their requirements. Mm-hmm.
I think this is an important step for better user interaction and also to reach new user groups.
So the Health Hub project is a Copernicus project that wants to collect all environmental data, Earth observation data from all the services, but also from ESA and EUMETSAT that can be relevant for the health sector. Health sector doesn't always use our data because they look too complex or are in a different place. And with the Health Hub, we want to collect all this data, put them in one place, and easy access for the health community.